My role is to treat and prevent gingivitis and periodontal disease, and also to educate my clients in the prevention of both those diseases. Firstly, we're going to identify what you actually do at home. Do you brush your teeth twice a day? Do you floss your teeth? Do you use a mouthwash? And then we're going to identify whether you have any problems by doing a gum chart or periodontal chart, and then get you on a regular maintenance. And it's like going to a personal trainer, just making sure that you're staying on track. We use very fine instruments to probe right around each tooth. We can find little bits of calculus and tartar underneath the gum line, and we use our instruments to scrape them away so that the gums can reattach to the tooth surface, and we polish the teeth and get rid of a little film where the bacteria actually lives in, that it's going to feel really clean and polished. It's going to stop bleeding in areas where you might have been bleeding before when you were flossing. And this way we're making sure that you're going to keep your teeth for the rest of your life. So we can see if there's anything that happens early on. If we see a little crack, we can communicate with the dentist and we can work out a plan together. You need to come in every 6 months. Should you get identified with periodontal disease, you do need to see your hygienist every 3 months. Everyone's prone to developing periodontal disease. There's certain factors that obviously makes you more prone, and unfortunately it's pain-free, so you're unaware that this is happening until it's too late. We also do cancer screenings, so if there's anything that we see that looks unusual as well, we can let the dentist know, and they can refer it onto an oral medicine specialist. Yeah, just getting to know people and motivating them to help them to have better oral hygiene, because oral health is so important and definitely has an impact on our general health as well.